Welcome to AM Best Audio.
The home healthcare sector faces unique risks and challenges, requiring specialized insurance solutions to protect businesses, caregivers, and patients alike. Tony Canci, Vice President of Underwriting at Philadelphia Insurance Cos, is well familiar with the evolving needs of this growing industry. He joins us now. Tony, so glad you could talk to us today.
Thanks for having me, John.
So, Tony, what is the market outlook for home health care?
Yeah, so the sector is poised for growth. If you look at the sheer fact that 10,000 adults have been turning 65 each day since 2011, and that trend's going to continue until 2030, so the end of this decade, you can see why there's such optimism in the growth for this space. Now, clearly not all adults will need assistance in their 60s and 70s, but as they continue to age into their 80s and 90s, many more of these adults will need assistance around the house and with everyday activity, daily activities. And when you couple that with the trend that families are living further apart more than ever, meaning, I can't just jump in the car, drive 10, 15 minutes to help my mom out or my dad out. I'm going to be relying on home care agencies and caregivers to provide that much needed care. The last aspect, I guess, fueling the potential growth is the idea that individuals want to stay in their home as long as possible. And the cost, and when you focus on the cost of care, home care versus facility-based care, it's a no-brainer. Home-based care is a much more affordable way to provide care than facility-based care. So needless to say, Philly has seen continued growth in our home health care book of business, both from startup home care agencies as well as existing providers, and we expect that trend to continue as the years progress.
What are the challenges the industry faces?
With the expected growth, staffing shortages is by far one of the biggest challenges and has been for many years now. Oftentimes, caregivers, their wages are on the lower end of the scale, despite the physical challenges and sometimes unpleasant job responsibilities they need to carry out. So this leads to burnout, and turnover in this space is very high. I would say roughly 40% or more. So staffing shortages can lead to challenges such as scheduling and coordination issues with the caregivers, which have led to claims where clients are left unattended for a longer period of time when there's supposed to be coverage in place. I say hiring someone is easy, but hiring a caregiver with the right mindset and skill set is a bit more challenging. And there's also been a ton of claims where there's a less than qualified or maybe trained employee providing care that resulted in injury to client. So at the end of the day, I would say more funding, maybe higher reimbursement rates in this space may help potentially close the staffing shortage by attracting more talent to this industry with increased wages and benefits.
Tony, what are the emerging risks within the home care industry?
So one of the biggest emerging risks in this industry is technology. In the home, we're seeing cameras, wearables, tablets, and other health or life-saving devices come into play. And these devices certainly have their benefits, but also present liability challenges from patient privacy to data security and other HIPAA-related violations. But we're also seeing technology come into play outside the home, where caregivers traditionally in the past have driven clients to doctor's appointments, maybe the store, or run other errands. We're seeing home care agencies now exploring ways to partner with Uber Health to incorporate ride sharing into their service offerings. From an insurance standpoint, this could shift liability away from auto and into other lines of business such as general liability and professional liability.
On the same lines of technology, how will AI factor into the home care industry?
AI, more specifically, I would say data analysis and predictive analytics will play a critical role in the home care space as we move forward. A few areas where AI could provide efficiencies is scheduling, coordination, creating personalized care plans, and maybe even predicting health issues before they become problematic. I would say an example would be where an AI could come into play is in a situation where maybe a caregiver gets an alert on a device that detects a client is about to get up, who's an at-fall risk client. So in this situation, the caregiver might be able to quickly maneuver over to the client before the client gets up and has the time to potentially fall. So this type of technology, can certainly add immense value and benefit to the space by reducing the number of slips and falls, which is by far and away the number one claim scenario we see in this space. I guess the real question is with liability. Where does liability fall when it comes to the analysis and predictive analytics when it's faulty or inaccurate or insufficient? Is it the software provider? Is it the caregiver? Is it the home care agency? Or is it another third party? So while I don't anticipate AI to replace caregivers, it will create efficiencies in this space and possibly help with the labor shortages that I previously mentioned.
Okay, Tony, the big question. What are the benefits of working with Philly?
Well, there's been a bit of some instability within the marketplace for home healthcare agencies. Philly's been writing this class of business for close to 2 decades now, which has given us the expertise in risk management, claims, underwriting to provide and continue to provide the best level of service we can to our clients in the years to come.
Tony, so glad you could join us today.
Thanks, John.
That was Tony Canci, Vice President of Underwriting at Philadelphia Insurance Companies. And I'm John Weber for Best Review Magazine.
Looking to get the full attention of the insurance industry? We have the platforms that will do just that. Whether it be AM Best TV, AM Best Audio, Best Review Magazine, or Best Day. Find out more by calling AM Best Advertising Sales at 908-439-2200, extension 5399, and have a great day.